today is my great pleasure to introduce today's speaker, Dr. Susan Anenberg. Susan is Associate Professor and Chair of the Department of Environmental and Occupational Health in the George Washington University, and she's also the current Director of the DW Climate and Health Institute. And Dr. Anenberg's research focuses on the health implications of air pollution and climate change from both local to global scales. And we talk a lot about like policy implications, and Dr. Anenberg is really the true pioneer of making the science evidence policy relevant. So she serves on the US EPA's Science Advisory Board and the Clean Air Act Advisory Committee, and the WHO's Global Air Pollution and Health Technical Advisory Group, and the National Academy of Sciences Committee to advise the US Global Change Research Program. She also serves as currently the president of the GeoHealth section of the American Geophysical Union. So without further ado, let's welcome Dr. Anenberg.
Thank you, Dr. Chen. And thank you all for being here today. I really appreciate you taking the time out of your days to be here. So I'm Susan Anenberg from George Washington University, and I will be talking today about linking climate change, air pollution, and human health, and bridging the science to the policy, which is really what I'm very passionate about doing. Should I admit people?
Yeah, click on one.
There we go. Okay. So before I start, let me just say that a lot of the work that I'm going to show today is really standing on the shoulders of giants. This is work that would not be possible without the people who have spent many years detecting associations between air pollutants and health outcomes, developing air pollution exposure data sets that are open and publicly available for others to use. And I appreciate the efforts of many people in this room in contributing to that science. And this really makes the bridging from the science to the policy possible by creating these data sets and associations that others can use. But based on the information that we have from epidemiology and exposure science, we know that air pollution continues to be a leading health risk factor in nearly all countries. It's currently considered to be the fourth leading risk factor affecting global mortality. That's not the fourth leading environmental risk factor. That's the fourth leading overall risk factor, and really indicates that air pollution needs to be central on the global health agenda for improving people's health. And if you look at the diseases that air pollution impacts, it is not a small fraction of these diseases that air pollution is responsible for. I mean, this is 40% of chronic obstructive pulmonary disease, 20% of diabetes, 20% of ischemic heart disease, and you can read the rest of the percentages there. So this is a preventable risk factor that is responsible for millions of premature deaths globally, and a very large, very substantial fraction of the incidence of these diseases around the world. And we also know that climate change worsens air pollution. So climate change is contributing to worsening ozone, increased wildfire smoke, increased dust, worsened allergy conditions, and even potentially impacting airborne infectious diseases, both the spread and the severity of airborne infectious diseases. So air pollution and climate change are highly interlinked. This is just one of the ways that they're interlinked, and we're going to talk about some of the others. But climate change is now worsening air pollution, making it harder for us to protect the air, making it healthy for people to breathe. And one of the ways that one of the most prominent effects of climate change on air pollution is now wildfire smoke. So I just want to look at some of the most recent work that I was a part of, looking at PM 2.5, very fine particle concentrations across the United States, the Eastern US, and then the Western US. And we see across the last couple decades for the United States, PM 2.5 concentrations have been declining substantially. That's a huge public health win, and is the result of many years of effective regulations under the Clean Air Act in the United States. So PM 2.5 concentrations have been declining substantially, and even more substantially in the Eastern US, where we have very strong anthropogenic emissions that have been controlled from our power plants and our vehicles over the last couple decades, and we've seen this very dramatic decrease in PM 2.5 across the eastern US. In the western US, we have a different story here with a lot of interannual variability in those PM 2.5 concentrations in the last 5-10 years, and that's driven by wildfire smoke. If you draw a line through this very large interannual variability, you see that PM 2.5 concentrations are actually increasing in the western US, despite the very effective regulations that we have on power plants and industry and vehicles. And that disparate picture between the western US and the eastern US is driving what we see here for the US on average, that we actually see that the PM 2.5 concentrations are beginning to flatten out. They're not declining to the same degree as they have been for the past couple of decades, and we're actually seeing that they're starting to stagnate. In the coming decades, we might actually start to see that they're starting to rise again. And this makes it more difficult for us to attain our national ambient air quality standards for PM 2.5 because of this climate-induced change in wildfire smoke, keeping PM 2.5 concentrations high. I had the honor of working with the U.S. Environmental Protection Agency on their climate change impacts and risk analysis project, their CIRA project. I used to actually work at the EPA from 2010 to 2014. And when I was there, we were starting this project to quantify the different damages of climate change on life in the United States. And that includes air pollution, but it also includes a lot of other things like labor and extreme temperature mortality and coastal property and roads. And back at that time, the only estimate of how climate change impacted air pollution and therefore damages through human health in the US was via ozone. So temperature worsens ozone, and that contributes to premature mortality. And you can see that back in about 2014, 2015, air quality was the fourth largest damage of climate change in the United States once valued. But we really recognized, we also think that climate change is influencing PM 2.5, and PM 2.5 has a very strong relationship with premature mortality. So if we were able to quantify the impacts of climate change on PM 2.5 in addition to ozone, we likely would get potentially a larger number. We would likely get a different number. Back in 2015, climate models were still very uncertain about where the precipitation happens, what's going to happen to PM 2.5 in different locations. And that still remains a big uncertainty. But we do know that climate change is driving quote unquote natural sources of PM 2.5, which are no longer, I think, can no longer be considered fully natural anymore because climate change is impacting them. So dust exposure in the Southwest US, wildfire PM 2.5, which we just talked about. So I partnered with the EPA and a number of other scientists, and we quantified the potential damages of climate change on dust exposure and therefore premature mortality in the US, and same with wildfire smoke exposure. And we valued that, and we came up with about $47 billion a year from climate-induced contributions to dust exposure and its effects on premature mortality, and about $25 billion a year for wildfire smoke. And if you add those together with the ozone impact that we had previously quantified, we see that air pollution is one of the largest damages of climate change in the United States. And this is an estimate that I think is likely to grow. I think we underestimated this impact due to the methods that were available at the time. So I think this number is likely to get larger. Another reason it's underestimating the damages of climate change on air pollution is because we can't just add together the impacts of heat on mortality and the impacts of air pollution on mortality. These actually have synergistic effects. So the total impact of increased heat and increased air pollution is more than the sum of its parts. In the previous slide I just showed you, we were only capturing the impact of each of these risk factors individually, not considering the others. But because we know that there are these synergistic effects, we're likely missing some of these damages of both heat exposure and air pollution. And as more research comes out looking at the pollen impacts as well, I think that could be potentially a factor to consider here too. So I talked about how there's different links between climate change and air pollution. We talked about this one, how climate change can impact air pollution. Air pollution can also impact climate change. We have short-lived climate pollutants, for example, black carbon and methane that contribute to poor air quality and warm the climate. This arrow here is, whoops, sorry, it should go from climate change to public health. But the other association between climate change and air pollution that I want to talk about is how they share the same emission sources. Anytime we burn anything, primarily fossil fuels, but also biofuels, we're releasing both air pollutants and greenhouse gases. So if we want to address climate change and air pollution, we should be reducing the amount of fuel that is burned and therefore addressing those emission sources. What we've done so far in the United States to bring down our PM 2.5 levels, we've tried to break this arrow between emission sources to air pollution. So we put catalytic converters on our vehicles, we put diesel particulate filters on our trucks, scrubbers on our power plants, and these have been very effective at reducing the amount of pollution from these emission sources. But they've done nothing to this arrow here. We're still continuing to emit greenhouse gases largely unabated. And that climate change is contributing to the air pollution problem. So if we want to, again, mitigate both air pollution and climate change, we need to be burning less stuff, primarily fossil fuels, but also biofuels. I have focused a lot of my work, especially in the most recent years, on the urban context. And the reason for that is because a lot of cities around the world are experiencing poor air quality. This is just a map of nitrogen dioxide concentrations in the US, but a lot of cities around the world are experiencing much greater levels of pollution than we do in cities in the US, especially in cities in Africa and Asia, which are rapidly growing. These are experiencing rising air pollution levels. Cities are also experiencing CO2 emissions growth. Right now, cities are responsible for about 3/4 of global greenhouse gas emissions, and that's projected to rise as the world continues to urbanize. We also have very strong health inequality impacts. So this is a map of Washington, DC, where I live. And the green colors here show the pediatric asthma emergency department visit rate per 10,000 people, and the red dots show life expectancy. We have about a 20-year life expectancy differential between neighborhoods in the southeast quadrant of the city, right here, versus neighborhoods in the northwest quadrant of the city. 20-year life expectancy differential between people that live about 2 miles away from each other. We also have very dramatic differences in pediatric asthma ED visit rate as well. So this is just, DC is not unique. We have problems for sure, but we're not unique. Most of the cities across the country are experiencing problems like this. And then we have growing populations. So right now, about half the world's population lives in urban areas. That's expected to grow to about 2/3 by 2050. And nearly all of that increase is anticipated to happen in African and Asian cities, where again, pollution levels are also continuing to rise. So there's a lot of problems happening simultaneously in the urban context. And if we were to address the way that our cities burn fuel, we likely would be able to get at multiple of these problems. What we can't see, we can't fix. We have to be able to see the pollution in order to fix it. Right now, this is where the monitoring happens for air pollution around the world. You can see most of the monitors are in the US and Europe, and increasingly in China and in India, but much of the world is left uncovered. And even in places that look like they're densely covered by monitors, like take Washington, DC, we only have 5 monitors, looks like 4, but 2 are co-located. We only have 5 monitors for the entire city of Washington, DC. So how are we supposed to capture the inequality in pollution levels if this is our only source of information? Luckily, we have a new source of information, which is Earth observing satellites. So NASA, the European Space Agency, and other space agencies around the world have been launching satellites, and they are constantly taking pictures of atmospheric composition. And we can tease out that information and understand what are people exposed to in places that have no monitors. This is a map of what nitrogen dioxide looks like from the TROPOMI sensor on the Sentinel-5P satellite from the European Space Agency. This map was created by Dan Goldberg. And you can see where NO2 is the highest and the fact that we have the full geospatial coverage here. So we can get beyond the monitors. We can get beyond the monitors and see what people are exposed to all around the world. So what does satellite data look like? Well, this is a daily snapshot of satellite NO2, TROPOMI NO2, nitrogen dioxide, that Dan Goldberg created. This is now available on our website. You can download for every day. It's automatically putting up this image of NO2 concentrations over the US and over different regions of the US. And you can see there's a lot of white areas, right? These are where clouds are. So the satellites can't see through clouds. We're still limited in that way. And there's also a lot of noise. This is just one snapshot per day. The TROPOMI sensor is polar orbiting. That means it goes around the Earth and it takes an image of the atmospheric composition at about 1:30 p.m. everywhere on Earth local time. So just the one snapshot per day. And this is what it produces, pretty noisy. But when we start to average over longer time periods, we have a lot more data and it starts to look more smooth. So this is a season of data of NO2 concentrations over the US, and then the comparison for 2021 to 2019. And again, you can get this on our website. So what we can do with the full geographical coverage of satellite data and the increasingly high spatial resolution as well is that we can start to tease out what is happening in all urban areas globally. And there's about 13,000 urban areas globally. So we can use that continuous spatial map that we get from satellite data and integrate and aggregate that up to the urban areas. Veronica Sutherland and Arash Moheg and Dani Balashov, who have all worked with me, have done this for PM 2.5, for NO2, and for ozone. So we now have available on a nice website as well, interactive website, the levels of these three pollutants, as well as their trends over time and their contributions to the burden of disease in those cities for all 13,000 cities globally. We've given the data to the Health Effects Institute, who runs the State of Global Air Project, and they have published this report, Air Quality and Health in Cities, for the first time, making the data more available for cities around the world to use. And I think it's important to note that in most of these, probably the vast majority of these 13,000 cities, there is no air quality monitoring. So this is the first time that there's really any estimate of the pollution levels in those cities. They're likely to be very uncertain, probably wrong in a lot of different ways, but at least it's a first guess at an educated guess at what pollution levels are, driven by the observations from these satellites. The other thing we can do with the satellite data, with the continuous coverage, continuous geospatial coverage from the satellite data, is that we can get at what is happening within individual cities. And again, we know that cities are experiencing health inequality issues. There's a long history of science telling us that air pollution levels are inequitably distributed within cities as well. But again, we can't get that just from the 4 or 5 monitors that we have in an individual city. So we need to use approaches for estimating pollution levels between those monitors to understand inequality in air pollution levels. So this is a study led by Maria Castillo, who's now an urban planning student at MIT. And we partnered with the DC local government, the DC Department of Energy and Environment, and the Office of Health Equity, who had, they had settlement funds from the Volkswagen Dieselgate scandal. Anyone remember in 2015, there was a big revelation that Volkswagen vehicles were equipped with these defeat devices, pieces of software that would turn the emission control equipment on when the vehicle was undergoing regulatory testing of emissions, and then off when they were being driven around in real world driving conditions. And that was leading to substantially higher, orders of magnitude higher NOx emissions in real world driving conditions than during certification testing. So there was a big lawsuit, people went to jail, and now cities have access to settlement funds they can use to direct resources to improve air quality. So the DC government had settlement funds, and they came to us and they said, can you help us understand how air pollution is contributing to the health inequality problem in the city so that we might be able to direct these resources to places that are overburdened. So we estimated PM 2.5 attributable mortality using one of those continuous data sets of PM 2.5, in this case from the WashU group led by Randall Martin. And we estimated PM 2.5 mortality rates. And we saw that the highest PM 2.5 mortality rates occurred in the eastern half of the city and lower PM 2.5 mortality rates in the western half of the city. And this lined up almost exactly with the map of racial segregation in the city. So the eastern half of the city is primarily Black and the western half of the city is primarily white. I don't know what that noise is. This research was received some interest from NASA, and they created this really nice looking map, and they made it the image of the day on the NASA Earth Observatory, which was really cool. And because so many people follow the NASA Earth Observatory, if you don't, you should on Instagram or whatever your social media choice is. They posted it there, and it got picked up by another influential Instagram account, Washingtonian Probs, which has hundreds of thousands of followers. So this was a way that our study, which was published in an esoteric journal, GeoHealth, was picked up and brought to people who wouldn't normally read papers in GeoHealth. And I know they tell you never read the social media comments about your work, but in a lapse of judgment, one day I decided to read those comments. And anyone want to take a guess at the most frequent comment the Washingtonian Probs account got when they posted this?
Thank you for your work.
That'd be nice. The most frequent comment was, duh. So, I think people know this, people know that air pollution is inequitably distributed, but again, if you don't show it with data and maps, then it's difficult to address. In this case, again, we worked directly with the DC local government, so it was a way that they were able to help us design the study to answer the question that they had, and then they can use the results to, to determine how they're using those settlement funds. Fun fact, on Friday, I just recorded a video at NASA NASA Goddard Space Flight Center. They are going to now have in the lobby of NASA headquarters, a giant screen with me talking about this study. And they did not tell me my face was going to be up there the size of my pores. So I'm not excited about that, but I'm excited that they are that they're highlighting this important work, because I really think it does show the value of satellite data and what it can tell us in terms of real world problems that we're experiencing in cities. So that was PM 2.5. NO2 is a pollutant that a lot of us don't think that much about. We often think about PM 2.5. That's the largest contributor to the burden of disease from air pollution, followed by ozone. NO2 is a precursor to both PM 2.5 and ozone. So if we want to address those pollutants, we have to know where the NO2 is and control it. It's also a high resolution tracer for urban traffic in particular. It's associated itself with asthma development. That's not just asthma exacerbation, but new development of asthma among children. And very conveniently, it is highly correlated. Satellite NO2 is highly correlated with ground level NO2 from monitors. So this, for example, is a scatter plot created by my colleagues Dan Goldberg and Gage Kerr, who show that TROPOMI NO2 columns, that's the amount of NO2 in the column of air between the satellite and the surface of the Earth, is highly correlated to NO2 at the ground level monitored by our AQS monitors, our air quality system monitors. And so this makes it a very convenient pollutant to study, whereas for PM 2.5, the satellites are monitoring a different quantity, aerosol optical depth, and then we need to do a bunch of science to convert that to ground level PM 2.5. Here, even if we just took the TROPOMI NO2 columns, we have a pretty good sense for where the ground level NO2 is. So around the time that the pandemic hit, we had just hired Dr. Gage Kerr as a postdoc, and we were wondering whether or not we could use these TROPOMI data. So TROPOMI data started, the record started in 2018. So it was very new. And when the pandemic hit in spring 2020, Dan Goldberg had been going through these NO2 readings and looking at different urban areas and seeing how the trends differed in different cities. And we wondered, could we use this data set to explore how NO2 changed during the pandemic? There were a lot of people working on air quality changes during the pandemic, of course. There's a whole community of people. We actually got on the phone once a month talking about air quality changes during COVID. But we wanted to take this a step further and really leverage the value of the satellite data with that complete geospatial coverage. And one of the values of that satellite data is the fact that we can look within cities, different subpopulations living within cities. So we had no idea whether we could use this data set to explore disparities and NO2 concentrations, but we thought, let's just give it a shot, see what happens. Probably we won't see anything. Well, it turned out we did see something, and it was really, really striking to me. So Prior to the pandemic in 2019, the least white census tracts across the United States had NO2 concentrations that were about double the concentrations in the most white census tract. Again, that's prior to the pandemic. During the lockdowns in 2020, both the orange dots and the blue dots shifted left. And that indicates that NO2 dropped for both the least white census tracts and the most white census tracts. Which is a good thing. You know, we had about 50% fewer passenger vehicles on the road. It's a good thing that we can observe NO2. Just by itself, that was useful to know that we could use this TROPOMI data set to observe that drop in NO2 during this natural experiment. But one thing that we found that was really concerning was that during the 2020 lockdowns, the NO2 concentrations in the least white census tracts were still about 50% higher than the concentrations in the most white census tracts prior to the pandemic. And this indicates that the disparities in NO2 pollution were so large prior to the pandemic that even about a 50% drop in passenger vehicle traffic was not enough to eliminate those disparities. And that pattern held for nearly all major cities across the US. It also held for educational attainment and for income. But really that only tells us about exposure, or really just concentrations, not even exposure. It doesn't tell us about the susceptibility of the population that is breathing those concentrations. So Gage took this a step further and looked at both PM2.5 and NO2, and not just the concentrations, but the health outcomes that are associated with those concentrations. So he's comparing PM2.5 attributable mortality per 100,000 people, and then NO2 attributable pediatric asthma incidence rate as well. And let's just look at PM2.5 first. We see that PM2.5 concentrations are dropping over time for both the most white and the least white census tracts across the United States. This is very similar to the graph I showed you at the beginning, showing that PM concentrations are going down, starting to stagnate a little bit due to those Western US fires. But the disparities persist, as many others have found in the literature as well, that PM2.5 concentrations and associated disease burdens are higher for the least white census tracts and than they are for the most white census tracts. And the relative disparity, the relative ratio between blue dots and the orange dots here is actually rising over time. So the relative disparity is getting worse, even though the levels are coming down for both population subgroups. For NO2 on the right-hand side here, we see that NO2 and its associated impact on asthma incidence among children is also decreasing over time, again, to very successful regulations under the Clean Air Act. But the disparity is much, much larger than it is for PM2.5. In fact, the relative disparity is about 7.5, meaning that the least white census tracts have values that are about 7.5 times larger than the most white census tracts. Whereas that value is only 1.3 for PM2.5. Not to diminish 1.3, that's still 30% larger PM mortality impacts for the least white census tracts compared to the most white census tracts. But NO2 exhibits far greater disparity than PM2.5 does. Now, all of this that I've just showed you is based on one concentration data set per analysis. And there's a lot of people working on a lot of different concentration data sets for both PM2.5 and NO2, and we don't know which one is the best. People are using different methods, they're using different approaches, different data inputs. And so we wanted to know how much of the result that I just showed is actually driven by features of the one data set that we used, as opposed to other data sets. Will we find this across multiple data sets? So Gage is now comparing NO2 disparities for 4 population subgroups using the EPA air quality system regulatory monitors on the left-hand side here for the 10 most populous cities in the US. The numbers on the right show the number of monitors in those cities. And we see a pattern that's kind of all over the place, in fact, no pattern. So these air quality system monitors are not able basically to capture the disparities that we think exist and that a lot of other studies have found to exist. When we use a land use regression model for nitrogen dioxide, which uses statistical approaches to approximate NO2 concentrations at pretty high resolution across the entire continental US, we see a stronger pattern pop out here. So for every major city, we have the lowest NO2 concentrations in the non-Hispanic white population. and higher concentrations among the Hispanic, Asian, and Black populations. The ordering differs by city, but it's very similar to what we find using just the TROPOMI NO₂ columns. So this is the land use regression model approximates surface level NO₂ concentrations. The TROPOMI data is NO₂ columns that are more directly from the satellite. And we see a very similar pattern here. We see that for both the non-Hispanic white population has the lowest NO₂ concentrations. For some cities, we see the ordering of the population subgroups is very similar. So in Philadelphia, the ordering is very similar. In other cities, we see differences. But nevertheless, there's much closer consistency between the land use regression data set and the TROPOMI data set compared with the monitor data set, which is really not surprising. I mean, the monitor data set was not intended to be used for this purpose. It really was intended to monitor regional average pollution and not neighborhood scale pollution that differs within cities. So that was for NO₂. That really led us to wonder, okay, well, the data set that you use for NO₂ has a big impact on the estimated disparities. What about for PM2.5, which is a pollutant that doesn't vary as much spatially as NO₂ does? NO₂ has a very short atmospheric lifetime. It stays pretty close to the emission source. PM2.5 has a lot more emission sources. A lot of it is secondarily formed in the atmosphere. It lives longer in the atmosphere, so it spreads out and sort of smooth spatially. But there's a lot of attention on PM2.5, right? The Justice 40 initiative of this current administration. This is a new initiative that is aimed at 40% of the benefits of federal investments going to disadvantaged communities. The data set they're using to do that, to identify communities as disadvantaged, has a 12-kilometer spatial resolution for PM2.5. That's this CMAQ model monitor fusion data set. That's the one that's used in EJ screen. It's used in a lot of EPA regulatory support documents. And now it's used in the climate and economic justice screening tool, CGEST, that is used for the Justice 40 initiative. So we wondered if we used a different high resolution data set that's now available from the scientific community, would that lead to differences in which communities are flagged as disadvantaged in the Justice 40 initiative? So we're now comparing the CMAQ model monitor fusion data set at 12-kilometer spatial resolution with the data set I talked about earlier from the WashU team, the Van Donkelaar et al. Data set that fuses satellites with a geophysical model. And then there's a new data set led by Haresh Amini that's available at 50-meter resolution within cities and 1-kilometer resolution outside of cities. And you can see, just looking at the spatial resolution, the spatial distribution in Los Angeles at the top, Chicago in the middle, and Phoenix on the bottom, these data sets, they look somewhat similar in terms of there being a blob over the city, but once you start to look a little bit closer, they really differ in terms of which neighborhoods are popping out at having the highest concentrations. So this is still a work in progress, but this is led by Dr. Tess Carter, who just recently finished her PhD at MIT. And I just want to point your attention to the top few rows here, which show all census tracts, urban tracts, and rural tracts across the US. On the left-hand side here is comparing the most non-Hispanic white populations to the least non-Hispanic white populations. And then on the right-hand side is most Hispanic versus least Hispanic. And we see for each of these three data sets, the CMAQ fusion, the Van Donkelaar 0.01 is that's the spatial resolution, and then Amini, all three of these data sets are very consistent in what they show for at those geographies. And it's very similar to, for each region, the absolute magnitude of the values of the PM2.5 concentrations differ, but the disparities, the patterns in disparity are similar. This is on a regional average basis. So what this tells us, I think, I'm still processing this, is that on a regional average basis, the CMAQ data set, not so bad for estimating those disparities. And you can imagine why that might be. For PM2.5, we have two things happening simultaneously. We have regional PM2.5 concentrations. PM is sort of higher in California and the Southwest US than it is in other parts of the US. And we have that happening at the same time as regional sorting of populations. There's a very large Hispanic population, for example, in California and the Southwest breathing those high PM concentrations in that same region. So that sort of regional nature of both population sorting as well as pollution, that's one effect. The second effect is what's happening in urban areas. So PM 2.5 has some intra-urban spatial variability, or so the literature tells us. And that, driven by anthropogenic sources within cities could be contributing to differences in neighborhood scale pollution levels within cities. So this maybe is actually not that surprising that this lines up pretty well regardless of the data set, because the spatial resolution of data set doesn't matter that much for that regional effect, that first effect I was describing. But for the intra-urban effects, the 12-kilometer data set is not going to be able to capture that intra-urban variability. So what do we see within cities? We see something different. So in the top 10 most populated cities across the US, one thing is consistent in that the non-Hispanic white population has the lowest PM 2.5 concentration in all three of these data sets. So we see a lot of the dark blue color left of one. One is the average, the mean PM 2.5 concentration for the entire population. The non-Hispanic white population has lower than average concentrations for every one of these major cities in all of the data sets. But the ordering of the other population subgroups really varies quite a bit depending on the data set. And that again is driven by the spatial distribution of the concentrations in the input data sets. I want to point out a couple other things. The CMAQ fusion data set, that 12-kilometer data set that's being used by the Justice 40 Initiative team right now, that has the least variability between population subgroups. And again, not surprising, this is a 12-kilometer data set, it's not capturing that heterogeneity, but we definitely see that play out where we have the narrowest range here for, I just picked out Philadelphia, for Chicago, and for New York. But then there's really interesting things that happen. So New York, Chicago, and Phoenix all show pretty different effects here, where in New York, we have the same ranking of population subgroups in terms of their PM 2.5 concentration for both of the two high resolution data sets, but not in the CMAQ fusion data set. In Chicago, we hardly get much variation at all in any of the three data sets. And then in Phoenix, all three of the data sets, including CMAQ, the CMAQ fusion data set, do have similar disparities across these population subgroups. So we're still trying to dig into each of these cities and understand why they're showing these different patterns. I'm really excited about the future because the satellite data we have available right now, this polar orbiting satellite data, that's a major improvement over what we had before, which is no satellite data. But we are now launching geostationary satellites, which are going to hover over the US as the Earth spins. It'll always be taking measurements over the US. So Tempo is launching in April, and that will be a geostationary satellite that's measuring atmospheric composition. I'm really excited about that. And then NOAA is working on GeoExo, which is an operational satellite that is intended to launch in the early 2030s. And they're still in the stages of explaining why this is important. So they asked us to help them explain why this is important for air quality management and for public health. So we've been really happy to be working with them and showing them the value of satellite data for managing air quality and for public health. And this is work led by Dr. Kate Odell, who is quantifying the number of poor air quality alert days across the US that you would get if you had a geostationary satellite, which is taking measurements across all hours of the daylight, versus if you only had that one snapshot from a polar orbiting satellite at 1:30 p.m. And she's showing that the number of air quality alert days is much, much higher for the GEO case, that's the geostationary case, versus the LEO case. LEO stands for low Earth orbit, which is the polar orbiting satellites. And we wanted to look at the disparities in the populations that are receiving these air quality alerts if we had the geostationary data versus the polar orbiting data. And she finds that actually, while the magnitude differs overall, the pattern of the population subcategories experiencing these poor air quality alert days is actually pretty similar depending, regardless of the geostationary or the polar orbiting satellite. Really quickly, I want to go back to the framing of climate change because, again, air pollution and climate change come from the same sources. Anytime we burn fossil fuels, anytime we burn biofuels, we're releasing both air pollutants and greenhouse gases. If we want to solve a lot of the problems that I just talked about, we could be burning less fuel and also be gaining by reducing CO2 emissions. So I have been able to partner for the last few years with C40 cities, as well as a variety of other partners who had been planning the largest worldwide effort for cities to undertake urban climate action planning. And these are cities that have committed to very deep decarbonization and creating ambitious plans for reducing greenhouse gases. And we help them understand not just their greenhouse gas reduction, which they're already very good at, but now understand also the reduction in PM 2.5 that they would get from taking those ambitious actions to reduce greenhouse gases. This is the framework that we did this within, and we implemented this in 6 pilot cities around the world. And I just want to show 2 of the examples. These are actually graphs that are now in these cities' climate action plans for the first time, integrating air quality into their climate action planning. So Buenos Aires saw their PM 2.5 concentrations go down from about 12 micrograms per meter cubed in 2050 to around 8, which was under the World Health Organization guideline at the time we did this analysis, but it's now over the WHO guideline because that has been reduced. And then Johannesburg took a bit of a different approach here where they looked at each type of action they could implement, and they looked at the percent of total PM concentration reduction from that action versus the percent of total CO2 emission reductions. And the one that achieved the greatest dual benefit was a mode shift from on-road vehicles. We're now helping them understand CO2 emissions a little bit more. So right now, each city is developing its own urban inventory of CO2 emissions. And that has advantages, strengths, and weaknesses. The scientific community is very hard at work developing gridded CO2 emission data sets as well, based on satellite observations of light at night and other data sources. And so we're looking at whether or not the self-reported inventories from the cities match what we think might be happening in the scientific community using these gridded data sets. And this is work led by Dr. Doyan An, where he's comparing the GPC inventory, that's the self-reported inventory, versus a very widely used globally gridded emissions inventory called EDGAR. And he sees that and this other one is ODIAC as well as a different gridded CO2 emissions data set. They line up pretty well. This is actually better than I might have expected prior to this project. But he sees a lot more scatter outside of the US and Europe and a lot more consistency in US and European cities. So just to conclude that climate change is worsening air pollution, which is already a leading factor for global health around the world. We have now access to data that's completely unprecedented. These novel geospatial data sets, they're increasingly capable of providing information about pollution levels everywhere in the world with full geospatial coverage, high temporal frequency, and in some cases now a building long temporal trend too. Some of these satellites have been flying for years. And that's enabled us to do a lot of different things. I just talked today about air pollution levels globally and in 13,000 cities, as well as intra-urban disparities. But people are using these satellite data sets in all kinds of unique and very useful ways, like spotting wildfire smoke and dust storms and things. I really think that this improved information, if we integrate this into our environmental management techniques, including policy development, we can achieve multiple societal improvements simultaneously. I've been really, really fortunate to be in a position now where I can be training the next generation to be using data sets like this. And there's new ways of doing environmental health that are now possible. So bringing in systems approaches and an equity and justice lens, in addition to engaging multidisciplinary teams and diverse partners. I talked about some of the partners I've worked with, including C40 cities and The DC government, that's just sort of scratching the surface, that if you work directly with these action-oriented partners from the beginning of a project, you can actually design a project to achieve the needs that they have to improve life for people. And, leveraging novel geospatial data sets is not something that I was, well, actually, I was trained to use novel geospatial data sets that were novel at the time that I did my training, which is before satellites. But, a lot of people in the field don't yet have that training, and it's something that we can bring into public health more frequently. There's a lot of communities of practice to plug into as well. We've developed a Climate and Health Institute at GW. We just are now completing a NASA-supported team called Satellite Data for Environmental Justice that brought together a lot of people that were using satellite data for this purpose. And a shameless plug to get involved in the AGU GeoHealth community, which includes a lot of people who are using these big geospatial data sets to answer environmental health problems. Very excited that Dr. Chen is part of that community as well. So that's it for me. Just wanted to acknowledge a lot of support and again reiterate that without open data sets, none of this would have been possible. So thank you to the data set developers. Thank you.
I think we can take around 5 to 10 minutes for Q&A. So if you do have a question, please.
Sure. Thank you so much for this talk. It's really interesting. I know that one of the major concerns amongst environmental justice communities with data sets such as EJ screen is that they're not specific enough, that they don't get down to that really granular level of fence line impacts. And I'm curious how, when working with large data sets from satellites such as TROPOMI, which only take that once-a-day measurement, you can also bring in those qualitative data points from environmental justice communities on the ground who are experiencing air pollution impacts.
I love that question because it really shows the value, not just in this kind of quantitative data work that I do, but in the lived experience as well. And we've run into this in multiple projects, and I just couldn't agree more with that because as I showed, we still have disagreement between several of the high resolution data sets that we're looking at. I mean, they are better, I think, than the coarse resolution data set. But if let's say you're looking at a map of Houston and you've got our land use regression data set of NO2 and then the TROPOMI data set of NO2, and you live in an area which is high in one data set and not in the other, what then? And that is the reality we are in right now. We're in this messy space of data sets not matching at that granular scale. And I just think it shows the limitation of what we can do with a one size fits all approach to be consistent across the US. We need to bring in people's lived experience and understanding of the local sources affecting their community for those data sets to be improved. How we do that, I think, let's get creative, right? I mean, we can bring in story maps of people's lived experiences. There's a lot of ways. It's not even just about, community monitoring, which can be quite helpful. And, we're rapidly expanding that in the US right now. But, people going out and writing about their experiences, taking videos of their experiences. I think that sort of community contributed qualitative approach has a lot of value. Yes.
I just want to make sure there's any students have a question first. Is there a hand over there? No. So my question, first of all, thank you for this fabulous presentation. I greatly enjoyed it. My question / comment is about environmental disparities. So a lot of times we see more and more beautiful, more and more detailed maps. However, if we could press a button today that made exposure equal across the world, first of all, we press it. But second of all, environmental disparities would still exist because people respond differently to health. So my comment to you, or my question is, what are your thoughts on this? Because I have had, when I talk with communities, 99 to 100% of them talk about exposure without talking about the fact that, and it is a fact that we know, that people respond differently. And to what degree do you think environmental health disparities could be there may be some environmental health disparities not incorporated into the world's most perfect exposure map.
Yes, yes, I completely agree with you that we have very focused on pollution levels. And the same pollution level can cause dramatically different impacts for different populations. I showed that map of Washington, D.C. and the high PM 2.5 mortality rate on the eastern half and the low PM 2.5 mortality rate on the western half. That actually comes from a pretty consistent PM 2.5 concentration for the entire city, but vastly different mortality rates. The southeast quadrant has had no hospital. GW's building one now. I'm very happy that that's happening, but no hospital, so no access to healthcare, no easy access to healthcare. This is the same, in cities all around the country and around the world that there's, social determinants of health are a major factor beyond exposure. And I think in terms of addressing it, I mean, we have, like I said, there's the climate and economic justice screening tools being used now for the Justice 40 initiative. We have EJ Screen to show where these disadvantaged communities are on a nationwide basis. Some are not accounting for that increased susceptibility, this increased mortality rates, higher mortality rates, higher health outcome rates. The CGES tool right now includes poverty and one additional indicator, so that could be PM 2.5. And EJ Screen has an index. I think if we were to use more of like that index approach that brings in poverty, brings in health, and some of these other social determinants of health, in addition to the pollution exposure, we can start to identify not just who is experiencing bad pollution, but who is most impacted by that bad pollution.
Thank you.
Yes.
Any idea what's causing the differences in disparities between cities? I'm originally from Chicago. The expressways run through Black and brown neighborhoods, which is true pretty much everywhere. But the disparities there for both NOx and PM 2.5 were fairly modest compared to some of the other cities.
It's such a great question. And we now have a big project with an Environmental Defense Fund to dig into Chicago specifically to understand that, because Chicago does have a whole lot of trucking that is coming through the city. And as you say, it is associated geographically with Black and Hispanic populations. There is, though, some other major roads that are more in wealthier, whiter neighborhoods, like Lakeshore Drive going north. So when you take like an urban average, it also very much depends, as I'm learning, it very much depends on how you define what the city is. Are you looking just at Chicago, the entire county, the entire MSA? And actually, we've seen that the disparities can flip depending on how you define the urban area. More details coming soon at Chicago, because that's an interesting one. Yes.
Thank you so much for the fascinating talk. Just I have a question about the time trend. So you showed that by racial, like ethnic, of their exposure, NO2 and PM. How does that change over time? Is there any like convergence across those groups?
Well, that's I guess I'd have to reshare the slides, but the project that I showed that had the PM on the left-hand side and the NO2 on the right-hand side that showed PM mortality rates and then NO2 attributable asthma rates, those do show trends over time. And the concentrations for both PM and NO2 are going down for all population subgroups, really great. But the relative disparities are increasing for both pollutants because of the changes in that overall magnitude. So yes, this one, thank you. So over time, the PM concentrations have come down approximately the same amount for all population subgroups. And that leads to an increased ratio between the population subgroups. And then for NO2, this doesn't really look like it, but these orange dots are going down as well. And much greater NO2 reductions for the least white communities, but still we see rising ratios of relative disparities.
Thank you. The reason I ask this is from the population migration pattern point of view is very mixed picture. The data shows that it's more segregation across cities, less so within cities in many parts of America. So
that's an interesting question.
Driven.
Yeah, we only looked at the temporal trends and the pollution levels, not where people are living. So that would be an interesting question to look into. Yeah.
Thank you. Thanks. We do have a comment online, but I think it's more like a suggestion. We can look at later. And thank you all for coming because we have a class right after us, so we have to end today. Thank you all and thanks.